Darren, welcome to Centric Health TV. How are you doing?
Yeah, great. Cheers, Dougie.
I'm super happy that you're here to talk all things about your Bridgit initiative, social prescribing, and all that fun stuff. So, to no further ado, how did you come up with the concept Bridgit in the first place?
So we've been looking at how do we support preventive care delivery in the UK for a long time, and I'd experienced that firsthand. So I had a team of community nurses out there trying to really deliver preventative care out in Manchester. And what I spotted with those nurses was that behind every patient there's a family group. And in that family group we've got what we call family carers. In the UK there's 6.5 million of those family carers, and they're doing an incredible job to look after their loved ones and to keep them well. But what I saw was there was a big gap, that the technology we're building was just for doctors and nurses. We weren't building tech to help empower the family carers. So that's where the idea came from.
Excellent. So something about caring for carers. It has this real inspirational dimension to it, because it's a side that's very much overlooked, giving the carers the right tools. So it's a social enterprise, I do believe. Yeah,
that's correct. Yeah, and I think to talk about that, so when we looked at the family carers and the systems, we wanted to really give back. So it was about how do we build a system that can help people like my granddad Dougie to stay well in his own home. And he's got the same name as you, right?
Indeed so, yeah.
And he wears the same jacket. So
there's something about being a Dougie, isn't there?
So my granddad Dougie, he's a perfect example of somebody in our health system we want to help.
Yes.
He's in and out hospital, unfortunately, had quite a lot of falls. My nan's passed away, so he's living on his own. And when you look at Dougie, I kind of talk about like a patient's clock. If you imagine their day as 24 hours, in that clock, about 10 seconds is taken up with clinician's time. You've got about 2 minutes that's taken up with community nurse time and 5 minutes with social care. And the other 23 and a half hours of that clock is with the family members. They're the ones that are looking after them. So that's why we decided as a social enterprise to set up and look at how we can look after those family carers. And you were spot on with the saying there. So we say, we care for you, so you can care for them. If we can help family carers, we can help save the NHS and the health system, because we know for every pound we put into a family carer, we're saving £14 to the system.
Brilliant. And also you're stemming the flow into A&E, into hospitals, and keeping people well at home.
Exactly.
There's an initiative about waiting well that NHS England are bringing out. So there's something about this model fitting. So how difficult is it for people to access services in the first place? Yeah,
so one of the trickiest things as a family carer is not knowing you're a family carer. So I maybe explain a little bit about how Bridgit actually works. So what we do is we have social media packages that help a region and the carers in that region through Facebook and Insta identify and come forward as family carers. We have an app that then supports them. So for people like my sister Anna, yes, she needs some help with looking after granddad on practical things, cleaning, toilets, using toilets and showering, it's real stuff. But also she wants to look after herself. So in our app, she can look at her education, her employment, what's out there for her as a carer. And then finally, we have devices like a watch or a home hub that help that family carer to remotely support their loved one and buy products from our shop. So that's the model. We can go into an integrated care system, we can identify the carers, we can support them with our products, and we can, through doing that, actually make a real difference to the health outcomes in the region.
Great. So you're not only identifying who these carers are you finding the numbers are going exponential in terms of people who didn't before think they were carers, but actually now meet the carers remit?
Yeah, so in the UK, the numbers are crazy. So we knew at the start of the pandemic we had 6.5 million carers, but out of those 6.5 million, only 3% are actively supported by local authorities. So 3% of those are actually supported today, 97% are unsupported. Over the pandemic, that 6.5 million went to 13.2 million carers. So that's from Carers UK, Carers Trust, that's their stats. So that's a crazy big number of people that we're not actually looking after and helping do that job today. And when you put that into the context of the economy, those carers contributed £132 billion of saving to the public purse over this pandemic.
Wow, the numbers are frightening, aren't they? They're
Crazy.
huge, they're huge. So in terms of the direct social prescribing piece, how do people access that service then?
Yeah, so for the products we've got, our app is available for free. So that's actually, we're going through trial with that app now, but that's launching and going to be available for free on store. So you can get support you need today. For local authorities or for regions, we can provide the tools to customise that app. So they can make that specific to their place, to their area, so we can link into local social prescribing. And then our watch or the home hub to help carers on the move or to support people in the homes, they can be bought from our website or commissioned through local authorities.
So how does Bridgit help integrated care systems overcome some of the barriers?
Yeah, so ICSs are all there for preventative care. That's what we created ICSs for in the first place. It's how do we really change the way that we commission and then deliver services across a broader region. The challenge they've got right now is that we've got massive waiting lists and we've got stretched clinical teams. Our nurses and our doctors are maxed out with the backlog. So what we're proposing is that to an ICS, we can come into a region, we can help carers in that region identify, we can support those carers with the carer charities already in region, and we can do that in a way that's then going to really drive improvements to health outcomes without actually needing the local health teams to do anything. I think that's quite a unique proposition, that we can go into an ICS with relatively limited funding and actually change the outcomes while not impacting the existing clinical teams.
That's brilliant, because you also mentioned charities there. Again, many times they're unsung heroes, and to bring charities into the equation, how are you specifically supporting charities?
Yeah, so in the UK there's probably about 300 carer support charities. So these are the guys that have stood shoulder to shoulder with our carer community over the years, and we wanted to give back to them. So we've built and launched our own marketplace. So it's a social enterprise marketplace for carers, all the products that carers need to do their role. And partnering with charities, we can give a percentage, so 10% of any sales from that marketplace from their carers goes back to those charities.
Brilliant.
And that allows them to then fund and do the amazing stuff that they're already doing today. The other thing we're doing as well is providing that app in a way that the carer charities can actually customise and configure that for their users. And that's going to allow them to actually extend out and grow the types of services they can provide using digital first.
Sure, and then that's increasing capabilities, making use of what you have out in the community, which is what we're trying to do. So thank you very much for that. Any call to action, any last words you have for our viewers?
Yeah, so we're obviously engaging lots of different organisations right now, but specifically I would love to speak to some of those integrated care system leads about how we can empower their family carers in their region to really change the health outcomes that they've got. And like I said before, we can do that in a way that doesn't impact their existing clinical teams and delivery. The other group I'd love to speak to is the carer charities that are out there. If you're out there and you want additional options to get funding through us, or different models to actually deliver your services, we'd love to speak to you as well.
No, thank you very much for that, Darren.
Yeah.
Thank you very much.
Cool.